On the other hand, to show the pattern of temporal effect of RNA therapy among the RNA group itself, we made comparisons between the RNA group at different follow-ups, and it also showed exponential improvement from baseline, 6 months and 11 months follow-ups with maximum improvement of untwist parameters, twist and ejection fraction after 12 months of follow-up. As regards the ejection fraction of the RNA group after 11 months, it was positively correlated with the left ventricular global longitudinal strain, twist, apical rotation, and negatively correlated with untwist onset and rate and pace of rotation. From all of these variables, the only dependent variables for the improvement of ejection fraction was left ventricular global longitudinal strain and apical rotation. These tables showed that there was no statistically significant difference. The table 2 shows that comparison between the RNA and the traditional group at 6 months follow-up, and as we see here, that there is a remarkable improvement in the ejection fraction and the global longitudinal strain, and some of the diastolic indices E over A and E over E prime, untwist rate and untwist onset, and also, but the twist mechanics is still not showing any improvement. The table 5 comparison between the RNA group itself at baseline and after 6 months and at 11 months, and as we see, there is an incremental increase, temporal increase of these parameters. This table shows the correlation of ejection fraction and other echocardiographic variables in RNA group after 11 months, and as we see, there is a positive correlation between ejection fraction and LV, global longitudinal strain, untwist rate, and untwist onset, twist, and base of rotation. These are a negative correlation. Table 7 showing regression analysis of the echocardiographic parameters in relation to the ejection fraction in RNA group after 11 months, and as we see, left ventricular strain was significantly coefficient, and also apical rotation. This scattered matrix plot showing positive correlation between ejection fraction and LV twist, and this is a scattered matrix plot showing negative correlation between ejection fraction and LV phase of rotation. Also, this scattered matrix plot showing positive correlation between ejection fraction and LV apical rotation. Also, this figure scattered matrix plot showing positive correlation between ejection fraction and average LV global longitudinal strain. The last follow-up of our patients groups after 11 months, there were a lot of data that strongly supports the idea of the effect of sacubitril/valsartan on left ventricular ejection fraction and reverse myocardial modeling, which might go in agreement with the proof heart failure trial, where the investigator stated that although improvement in cardiac structure and function was present at 6 months and at 12 months, further improvement in ejection fraction and volumes was present within 25% of the study participants experiencing at absolute left ventricular ejection fraction increase of more than 13%. In that trial, they depend on the changes in left ventricular end-systolic and diastolic and left atrial volumes, but in our study, we selected a more precise speckle tracking deformational parameters which had a more sensitive predictive values and accuracy, where we demonstrated that at 11 months, most of the torsion mechanics and the left ventricular global ejection fraction, in addition to diastolic parameters as untwist rate and onset, that means systolic function improvement and LV recovery. Conclusion: to our knowledge, this is the first study to demonstrate clear recovery of the untwist and twist mechanics, global longitudinal strain, left ventricular ejection fraction, and heart failure reduced ejection fraction patients under 11 months of therapy of sacubitril/valsartan. That effect might be explained by a state of chronic deluding with reduction of left ventricular endodiastolic pressures, which consequently helps in restoration of Starling forces with recovery of left ventricular geometry that finally lead to the improvement of the myocardial performance. And thank you.